Hello, I'm Dr. Anjali Gokarn, a practicing pediatrician for the last 35 years in Vasai, a suburb of Mumbai. In our last episode, we heard Dr. Palni Raman speak about the childhood onset of adult disease. And today I'm going to speak on the first 1000 days of life and how we can take care in this time to prevent that. What are the first 1000 days of life? That is the time of a child right from conception to the end of the second birthday. This is the time of maximal physical and brain growth. And this is the time when the neurons are growing and making connections with each other depending upon the stimulus they receive from their caregivers and their environment. If there is nurturing care during this time, then it lays a very strong foundation which will go ahead and give the child to lead a very productive adult life. It's like building a huge building with a very strong foundation, and it can withstand all the vagaries of nature. Anything that goes wrong during this time, we lose a very important period of neuroplasticity, and it can have very adverse effect on the child, the family, and the community. So we as caregivers during this period, critical period of a child's brain growth, have to take care, and I have divided this into 3 parts to make it easy. It's the care we take during pregnancy of the lady, it's the care we take in the newborn period, and the care which we take from the 1st to the 24th month. What is the care we need to take during pregnancy? Now for this I have an easy mnemonic which is 5D. That is diet, development monitored, then drugs, doses, and discuss delivery. What about diet? Mothers have to consume a nutritious, balanced diet, and that would include all the food groups, that is proteins, carbohydrates, fats, and the micronutrients. With food faddism, veganism, and some of the mothers who have these nutrients out of reach, this may seem difficult. And so as caregivers, we take care to see that the mother consumes all this. The other D is development. The fetus inside is growing, and hence we need to monitor the mother's health as well as the baby's health. This can be done by timely doctor visits in the first 2 trimesters every monthly, in the last trimester fortnightly, and in the last month weekly. And during these visits, she should be weighed, look for edema, her blood pressure taken, and in the first few days a lot of important tests to be done, like her blood count, her blood group, other things to rule out hypothyroidism, other infectious diseases. Sometimes we may even do the sickle cell or the thalassemia test, and also if a mother wishes, we can do tests to rule out chromosomal disorders. There are timely ultrasonographies to be also done to look for fetal well-being, growth, and amniotic fluid content. All these should be done on follow-up visits. The third D is drugs. By that I mean that mothers will need supplementation with iron and vitamin D, as more than 50% of our mothers lack these essential nutrients. And all mothers after their first trimester should be supplemented with iron, vitamin D, and calcium. And the other D we are talking about is doses. The important vaccinations. The important vaccinations a mother needs to be given are the flu vaccine and the booster dose for tetanus and diphtheria, either the TD or the Tdap vaccine. And the last D is discuss delivery. Every mother should know whether she has twin delivery and what is the likely mode of delivery she is going to undergo. Is it going to be a normal delivery or a cesarean or any other assistance needed? With this pregnancy care, we now go to newborn care. This is the transition from fetal life to life outside, and also needs to be taken care of very, very well. And there's a mnemonic for this too, and that is 3B and 3O. The 3B are be prepared, breastfeeding, and blood tests, and the 3 O's are oximetry, ophthalmoscopy, and OAE. So be prepared. I mean, there should be a trained assistant for neonatal resuscitation present at every childbirth, because an adverse event could occur anytime. If there is a high-risk pregnancy like a twin, or there has been intrapartum hemorrhage, or there is polyhydramnios, or there is a preterm delivery, or likelihood of fetal asphyxia, then there should be a trained pediatrician or a neonatologist present during the delivery. Any transfer to a neonatal intensive care should be done most cautiously and as promptly as possible. This kind of care will prevent any long-term morbidity arising from the birth event. Other things we need to take care of is initiate breastfeeding early within the first hour, and any mother who has a high-risk pregnancy or difficulty should be given the support she needs, and the help of a lactation counselor should also be sought. The other P we are talking of is blood tests, and blood tests which are needed would be a CBC or a blood group for the baby, a bilirubin, other tests to rule out congenital hypothyroidism, a G6PD deficiency, or other inborn errors of metabolism like congenital adrenal hyperplasia, galactosemia, etc. So there are newborn screening tests which can be done. O for oximetry. Oximetry is a very simple test done by the bedside after the first 24 hours, and this can tell us whether there are any important serious congenital cardiac illnesses which need to be looked into, and anyone who fails this oximetry test should be referred to a pediatrician or a pediatric cardiologist. Ophthalmoscopy. Of course, we know that all preterms born before 32 weeks should undergo screening, or those with high-risk pregnancies, a high-risk baby should undergo ophthalmoscopy by a trained pediatric ophthalmologist. But all newborns deserve to have a red reflex test done by the bedside before discharge to rule out any serious visual problems. OAE, this is a screening test for hearing, and all newborns should be subjected to this hearing test. Newborns who fail this test or preterm babies, high-risk babies, need to have a BERA testing done at 3 months additionally. With this, I have completed what we can do during newborn period, and we go on to the period between 1 to 24 months. Again, here there are 5 Ds to be applied: diet, development, drugs, doses, and danger signs. So diet in the first 6 months is exclusive breastfeeding. It lays a very strong foundation for future life. After the 6 months, complementary feeding started adequately, soft, mashed, thickened feeds with home cooked material like dal, rice, chapati, cooked mashed vegetables, all fruits. So everything parents consume at home should be offered to the baby, and by 1 year, a baby should be eating half the adult diet. And breastfeeding should be continued until 2 years of age. Development, this is, like I said before, this is a time of rapid brain growth and development in all domains: the motor, fine motor, social, emotional, cognitive, language is something that has to be nurtured. And all parents should be counseled about nurturing care during this period and development monitored. Monitoring is easily done on developmental charts and MChat, which can detect autism at an early stage at 18 months and 24 months. And just like we monitor development, growth monitoring by growth charts is very essential so that we can pick up children who falter in their growth either due to some illness or any other factors. What are the drugs that need to be given? Just like ladies are iron and vitamin D deficient, most of our children are also iron and vitamin D deficient, and iron and vitamin D needs to be supplemented for all children. Iron supplementation above 6 months till the age of 5 years bi-weekly, and vitamin D daily dose till 1 year and to be continued if deficient thereafter. Doses. All parents should be encouraged to give all the required vaccinations and should be checked at every visit. There are some danger signs about which I will not speak, and in summary, I'd like to say that the first 1,000 days lay a very strong foundation, and thus care should be taken for the fetus during pregnancy, in the newborn period when it's a transitional period, and for all children from 1 to 24 months. And the last D, that is danger signs, will be covered by Dr. Mahesh Mohite in the next episode when he speaks about first rule out seriousness. Thank you.